My journey began in deciding that I want to work with trauma. Here's what happened. In the first day of my class in my doctorate program, the instructor started telling us a story about Hurricane Katrina. He had been a first responder, and there was a woman who described her son had died, and she had a box of his things. And in the hurricane, the waters kept rising, and the box eventually was taken away. And you know, the part that was really upsetting her about the trauma, sometimes we think we know what's disturbing to someone in a trauma, but we don't. And for her, it wasn't that she lost her house, it was that she lost this box of her son's things. So the instructor says to her, who by the way was Buddhist, he says to her, "Where is your resource?" So for her, it was Jesus. And he said, "Okay, where do you feel," these are his words, "where do you feel Jesus in your body?" And she pointed to her chest. And he said, "Okay." And now he says, "I want you to think about that box and hold that box in your hand." And he had her pendulate between the resource and the loss. And eventually what he saw was her eyes came back online, color came back to her face. And when I heard this story, I thought, you know, wow, that's amazing. Whatever that is, I want to do that for me. I want to learn that, and I want to use it. So I'm not going to go largely into definitions of trauma. I believe you all have read the DSM. I'm going to just keep it brief so I can get to some main points. But I will say, I like what Peter Levine says. Peter Levine says trauma is in the experience, not in the event. We have what we call big T traumas. Most of you know about this: disasters, attack, rape, domestic violence, bullying, loss, all big T traumas. And then we've got the little t traumas, which often are characterized as a critical, unpredictable, or alcoholic home, feeling invisible. And of course, the little t's go on ad infinitum. But the thing about the little t traumas is they do what we call stacking. Like within the nervous system, they stack up. That critical home, whatever, that can affect the nervous system the same way someone else might have a big T trauma.